All right, we are on. Thank you so much for joining us. Welcome, everybody, to this week's episode of Weekly Dose with Dr. Uday. We are back. This is a part 2 with Dr. Anderson. So, part 1, we had talked about post-traumatic stress disorder. This episode, we're going to be talking about postpartum depression. All right, so I'm going to start with introductions. So, for everybody that doesn't know me, I'm Dr. Uday. I'm a board-certified family medicine physician based in Martinsburg, West Virginia. I own a primary care practice, Apple Valley Family Medicine, and I'm also in aesthetics. And my goal is to have my patients feeling good and looking good. All right, so for Dr. Anderson, let me give you some information about Dr. Anderson. She specializes in the treatment of post-traumatic stress disorder, anxiety, and depression. She opened the first psychiatric-based ketamine infusion clinic in the state of Ohio and is one of only 12 providers in the country to offer prtms, and it's a revolutionary form of non-medication alternative treatment. So Dr. Anderson, welcome back. Thank you so much.
Thanks for having me.
Yay. So postpartum depression, what would you say that is from your definition?
So everybody talks about the baby blues after they have the kiddo and the hormones have tanked and they're up all night and they're feeding the kiddo and they are not going out with friends and they're rarely showering, and it's a lot to take in all at once, right? The hormone crash is to be expected, the tearfulness from time to time, the overreaction also to be expected. Hormones can suck. But the difference between baby blues and actual postpartum depression is significant. And so when you are starting to want to sleep too much all the time, or even when you do have a chance to sleep, you're not sleeping, if you've lost interest in things that once served you well in terms of bringing you joy, if you have guilt feelings all the time for not being a quote better mom, if your energy level is tanking, if your concentration level is awful, if your appetite is going way down and you're not able to keep up enough for your milk production, if you feel like you're slogging through like molasses or you feel like a wind-up toy, if you have suicidal thoughts, if you have a depressed mood, all of these things point more towards actual postpartum depression. It's treated very like standard depression. The only difference is that if you're breastfeeding, we need to take that into account to make sure that we use medications that are less likely to pass through the breast milk or at minuscule amounts. The other biggie is that making sure that postpartum depression doesn't turn into postpartum psychosis, where you're starting to see things or hear things that you're not sure are there. You're believing people are out to harm you, hurt you or the baby, or believing that, your food is being poisoned or messed with, or hearing things to like harm yourself or harm the baby. That's the case where family members need to get involved. Possibly Child Protective Services has to get involved. That can be a very scary situation. Antipsychotics sometimes need to be used, and not necessarily for the rest of your life, but during that period of time when women are more hormonally susceptible to having these extremes of emotions. It's a big safety issue, and family docs who are first line people, pediatricians, OB-GYNs, first line people, if they don't already have an established relationship with a psychiatrist or one's not available in their community, you guys are the first ditch effort to catching those things and making sure that mama and baby are safe.
Absolutely. So how is it diagnosed?
So we take a good history and we look at the symptoms. Like I said, we use the acronym SIGI-CAPS in terms of the sleep, interest, guilt, energy, concentration, appetite, psychomotor activity, suicidality, and depressed mood. If all of those things have been happening for 2 weeks or longer and you're not getting kind of a bump back up, like say with breastfeeding, most people have the tank initially in the first few hours from giving birth to a week or two. But if it's been longer than that and they're breastfeeding and that isn't sort of bringing their hormone levels back up and they aren't responding, they're not wanting to be out with friends, they're not wanting to do the things that they normally do, despite the, difficult, stressful interaction with the baby and getting on a new schedule and all that. If they're not kind of bouncing back as quickly as we'd anticipate them doing, that's when we want to intervene with medication just to make sure mama and baby are safe. So it's especially noticeable if you are living with a partner, husband, wife, friend, that says, you're just not yourself. I know it's stressful taking care of a baby and stressful being up all night, but if you're still not like even finding joy in your baby cooing or latching on, then there's a problem.
Absolutely. Now, I would assume that a lot of people are affected. Who's affected by this? And, what I mean is like, obviously the mom that is going through it, but who, from your experience on taking care of this, who's affected?
So dads, wives are affected, kiddos are affected. People who have had a mental health history in the past, even if it's just panic or just anxiety or just depression, are 2 to 3 times more likely to suffer from postpartum than they would be otherwise. And I've seen it a lot in mamas who've had depression for many years and who've been on a maintenance dose of whatever antidepressant, and they decide to go off the medications for pregnancy, and they do fine because their hormones are taking care of everything. And we actually tell them the second the baby's born, you need to start meds again to decrease the likelihood of you suffering and not connecting with the baby, because those first few weeks are so integral. The skin to skin contact, the latching on if you're breastfeeding, the feeding, the eye to eye contact, all of that is so important in creating a connection with your child that a depressed person may not be able to have that connection.
Absolutely. What other treatments are available?
So treatments that are available, the big ones are psychopharmacologic, the antidepressants, especially the SSRIs. There are a handful that are relatively safe in pregnancy and a few that are safer in breastfeeding, but you have to talk to your doctor to make sure what's right for you, what's worked for you or your family members in the past, and whether or not you're breastfeeding makes a huge difference. The other option too would be something that we offer called prtms, because it's non-invasive. You could still breastfeed. That wouldn't change the components of your breast milk. It wouldn't change your internal chemistry, but it would change the way that your brain is perceiving and functioning. And so you could do that while pregnant or breastfeeding.
Gotcha. So guys, you've heard it. So how can people look you up, connect with you? Because I'm pretty sure there are going to be a lot of people that want to find out.
So you can get online and get on www.andersonclinic.net. If you're in the Cincinnati area, feel free to call 513-321-1753. And if you're a podcasting kind of person, then you can check us out on Spotify or Apple Podcasts on Psych Waves.
I love it. So guys, definitely check her out. Oh, thank you so much. This was fun. Thank you.
My absolute pleasure. Thanks for having me.
I love it. So guys, check her out. And then if you're looking for a primary care doctor, we are accepting new patients at Apple Valley Family Medicine. Our number is 304-350-1087. And you can also find us online at www.applevalleyfamilymed. Enjoy your week, guys. Bye.